Hello, everybody. Welcome to today's video lecture, and we continue covering the cardiovascular system, blood. Now, I already covered function of blood, composition of blood, and erythrocytes in my first video lecture. So here we're going to cover white blood cells or leukocytes. So let's go ahead and begin. Now, first of all, how many leukocytes we have? Let me pick up my pen. So, for example, if when we talked about red blood cells, in 1 microliter of blood, you have 5 million of red blood cells. Now, you have way less lymphocytes or white blood cells. You actually have, instead of 5 million, you have 5 to 10,000 in 1 microliter. So, less numerous cells. Now over here, you see our formed elements. Now your blood, I want to remind you, is made of plasma and formed elements. And formed elements include erythrocytes that we already covered in the previous lecture, platelets, and here's our leukocytes. Now we have different type of leukocytes, and you don't need to remember those numbers, but you need to remember their relative concentration. And there is a mnemonic to remember it, and mnemonic says never let monkeys, that's M, eat bananas. I'm sorry, take me forever. Eat bananas. So the more abundant leukocytes are neutrophils, and this is this letter N. Then the second most abundant are lymphocytes. So that's our letter L. Monkeys, M is monocytes. Then we have monocyte, eosinophils, and the least abundant are basophils right here, right? So we have neutrophils, we have lymphocytes, monocytes, eosinophils, and basophils. Let me erase everything. Okay, clear. Leukocyte characteristic. They are less numerous than red blood cells. We already mentioned it, about 5 to 10,000 per microliter. They are larger than RBCs and they are complete cells. If you remember red blood cells that actually shown right here, for example, they're not complete cells because they lack nucleus and major organelles. White blood cells, they have nucleus and mitochondria and endoplasmic reticulum and all other organelles that you would find in a regular animal cell. They have a shorter lifespan. Some live just few hours and even few minutes. So on this diagram here, you can see the main types of white blood cells. And what is interesting is actually white blood cells, leukocytes, can be divided into granulocytes over here and agranulocytes. Now, granulocytes, if you look inside a cell in the cytoplasm, you will see granules, right? And that's why they were named granulocytes. In agranulocytes, you will not see those defined granules using just a regular light microscope. And here's a picture of neutrophil, for example. So you can see the neutrophil has a nucleus. This dark part is nucleus. Nucleus has several lobes, and you see granules. Eosinophil over here. Eosinophil will have this pink appearance of cytoplasm, and again, lots of granules, and this dark part is nucleus. Basophil over here, and agranulocytes will have monocyte. So this purple stuff, this is a huge nucleus, and lymphocytes. So again, this part is nucleus as well. Okay, so we already mentioned that leukocytes is divided into granular and agranula. Granular contains granules, neutrophils, most common. They are phagocytic cells. Actually, all of them, neutrophils, eosinophils, basophils, they all have phagocytic properties, more or less, right? Neutrophils are pretty phagocytic. We call them microphages, not macro, but microphages. And they polymorphonuclear. That means, look at this, we have lots of lobes of a nucleus. Poly means many, morpho means shape, and nuclear is nucleus. So nucleus is made of, you know, several lobes, many shapes. And this one, the major job is to fight bacteria. Eosinophil fight your parasitic worms. So they're shown over here. They will appear pink when we use a dye to make them visible. And they have bilobe nucleus. So the nucleus is made of 2 lobes. And basophils are the least common white blood cells and important for inflammatory response, and they secrete histamine. So that's our basophil. Agranulocytes include lymphocytes and monocytes. So they have less visible granules. Lymphocytes, there is 3 types of lymphocytes: B cells, T cells, and natural killer cell. Now this lymphocytes over here is the smallest leukocytes. So it's a little bit bigger than red blood cells. So this is our lymphocytes, very important cell in the immunity, because it will differentiate into B cells and T cells. And monocytes is one of the largest leukocyte, shown right here. So you can see how huge this cell is. And this is what we call macrophage. Actually, monocytes will differentiate when they are not in your bloodstream. We call them macrophages, and they phagocytic. Disorders of leukocytes will include leukopenia. Penia means, so if you see this part, penia, that means too few. So leukopenia is too few leukocytes. Leukemia, emia means blood. So you have white blood cells in blood. So it's abundance of leukocytes. And lymphoma is malignant tumor. So it's a malignant T or B lymphocyte accumulation, right? This is actually, you can see lymphoma right there, because cells are do not look normal. Not only we have abandon of those cells, but they also look bizarre here. Okay, so again, leukopenia, too few, leukemia, too many, and lymphoma, that is a malignant tumor of T or B lymphocytes. Also form element include platelets, right? Another name for platelets is thrombocytes. You have about 150 to 160,000 per microliter of blood. You have a lot of platelets in your spleen, and yeah, 10 days lifespan. So you can see those cells do not live very longer. Now, platelets actually are formed by cells called megakaryocytes. Platelets are fragments of cells. So look, like over here, this is a platelet, this is a platelet. So those are not complete cells. They are pieces of this megakaryocyte cells. So let's look at next picture here. We start with myeloid stem cell. that will differentiate in megakaryoblast, then into megakaryocyte, and then we have those pieces of the cell, right, that form platelets. Now, platelets are critical for hemostasis, and this is the hemostasis means blood stop. So when you cut yourself, you need to stop bleeding. That's the process of stopping bleeding and losing blood is called a hemostasis. And of course, platelets, platelets are needed to initiate hemostasis, and then you have, so you have formation of blood clot, plug, and then blood clot, right? You stop bleeding. And platelets, they secrete growth factor and platelet factors and many other chemicals important in this process that will be discussed in physiology. Yeah, production of platelets, that just, I guess, refer to this diagram right there that we already covered. Platelet disorder include thrombocytosis, too many platelets, and thrombocytopenia. So you see this penia again, too few platelets. So for example, over here is thrombocytopenia, because I really see like one. Remember, we should have more platelets than white blood cells. So if you look at a blood smear, the cells, the most numerous cells over here will be our red blood cells. By the way, I don't know what's going on with this red blood cells. Seems like they are go through crenation process. They do not look normal here, but this is the white blood cells. And those are platelets. So we have 5 million red blood cells. We have 5 to 10,000 white blood cells, and we have about 150 to 150 platelets, right? 150,000, I'm sorry, 160,000 platelets. So this is how the normal blood smear should look like. So you should see quite amount of platelets when over here, I hardly see maybe 1, maybe 2. I don't know, this might be a platelet as well. Okay, this was a very short video lecture because most of this PowerPoint was covered in part 1, and I will record another part where we will cover physiology of blood, and we will talk about hemostasis in more details. So thank you for watching, right? So that was cardiovascular system, blood part 2, and I hope it was helpful.